Tim Spector, he's Professor of Genetic Epidemiology at King's College London. He's also the founder of the Zoe app, which tracks the infection rate and has been a really key indicator of where infections are going on COVID throughout this pandemic. Good morning to you, Tim.
Good morning, Julia.
Morning. Always good to speak to you, sir. Prime Minister yesterday wasn't giving much away about our roadmap, our exit strategy from lockdown, about when it would actually start and how long it would take. Lots of different pushing and pulling from scientific advisors and economists and business people and indeed backbench Tory MPs. In terms of what you have seen of the data, what you're seeing in the Zoe app and the data on falling deaths, hospital admissions, people in ICU and infections, what would you be advising the Prime Minister to do?
Well, we've been seeing drops for nearly 6 weeks now, steadily since the 1st of January, which is different to some of the other data, but it's given us more reassurance that by now we would have normally seen a tailing off of the R rate as those rates have come down below 20% of where they were at the peak. So it's looking to us that the vaccination program is working and that is helping with the lockdown together, driving down these rates. So because we also know from our own data that we've been following about 50,000 health workers who've had a single Pfizer dose, that we are seeing reduced infections in that group just after 2 or 3 weeks by up to 70%. So if you take all that together and you think how many people have been vaccinated, then I think I'd be looking at a more optimistic picture than has been painted by many of my other colleagues who are perhaps painting more a worst case scenario, that if all the bad things happen, then we could be back at square one.
We've spoken to one of your epidemiological expert colleagues at a different university earlier in the show. He's talking about, look, if we released all lockdown restrictions, and again, that would assume we went back to zero social distancing, no masks, no washing your hands. We just went back to life as it was, back in January, February last year. God, wasn't that wonderful, folks? That we could have an R rate up to 4 even. 3 having been the peak that we saw in this country. But again, that would assume no seasonality in the virus, which certainly from what's happened in the Northern Hemisphere and the Southern Hemisphere would suggest that there is a strong seasonal aspect. But also it would assume that the vaccine rollout has had no effect. And as you say, looking at the healthcare workers and the younger age groups that fall to 70% in their infection rates, we've already seen the death rate in over 80s for the data up to February the 6th. That has gone down. So the case fatality rate in over 80s has fallen by 35%, whereas the case fatality rate in under 80s who haven't had the vaccine or had time for it to take effect if they've had it in the 70 plus age bracket has fallen by 5%. I'm sure maybe that there could be some other factor that's having that effect, but one would assume that the most likely explanation would be the vaccine is providing not just protection from death, serious illness, but is also, one would hope, also preventing transmission as well.
Yeah, and I think there's little doubt the vaccine is working. I think there's some disagreement how much it's working. And as you said, there's a lot of disagreement about the models that have been given to SAGE-R that are painting a pessimistic picture.
Oh, goodness me, our sound just went for a second.
Only looking at...
Apologies, Tim. Sorry with this, the technological joys of Zoom interviews. You're saying the model, just to go back, the models that SAGE has been looking at, and they would include things like there's an Imperial College model, which came out yesterday, but actually been seen before it was actually officially published. But these are predicting us going back to death rates, higher than we saw at the peak last year.
Yes, and there are other ones that aren't as extreme from Warwick and others, and as models go, they're all reasonable. But what they're doing is assuming that the vaccination is only partly reducing the transmission rate.
Yeah.
So that we're only seeing around 50% reduction in transmission rather than say a 95% reduction in transmission, which a lot of my colleagues believe is also possible. So I think it does slightly depend if you're a glass half full or glass half empty person. If you believe all the worst case scenarios, then yes, relaxation of rules could lead to, this percentage of people that aren't vaccinated or that aren't protected from vaccination, causing many deaths and hospitalizations. But on the other hand, if you take the view that, if you can get 70% of the population vaccinated, and that has a 90% reduction in infections and transmission, it's going to put us in a really much better place and be much more relaxed. Yeah. So I think it really does depend. But also, we have been focusing all our attention on deaths. And that's what the vaccine task force, the people that are deciding on who gets vaccinated have been focusing on as the number one priority. And I think it might be good to start re-looking at that and say, well, okay, we've got the deaths down now to, I think it was 500 or 600 in the last few days, which is only a third of the number of deaths that would normally happen on a day in February. Okay, so people also fail to see that context.
Yeah.
That
a lot of people seem to think that no one ever died of anything before February, March last year.
So it would be good in the news to say, well, actually, on this day last year, 1,500 people died. Today, 500 died of COVID and 1,000 died of heart disease and cancers. I do think we do need that. But as we move away from just deaths, we do need then to talk about the other side of things and look at hospital effects and getting the NHS back and education and putting this all in terms of quality of life years for everybody, rather than just focusing on the deaths which mainly occur in the over 80s. So I think now we've protected that group. I do think we need to change the discussion more to broaden it out and not have models that only have really death as the outcome. And we need to broaden it. That's why I think it's really important that we, like most other countries in Europe have done, is prioritize schools.
Yes.
And they haven't been closing them. They've been sending them back with similar numbers to us. They've given the kids masks. They've just said, whatever it takes, we're going to keep our children educated. And I think that has such a huge long-term impact that we do need to look beyond just the next few months. We do need to be...
Yes, I think the effects of our kids being out of school for what will end up being, for lots of them, best part of a year on and off, we haven't even begun to see the side effects of this on our children's mental, physical health, their academic ability, their job prospects, future health. I mean, the huge impact. But this is just the thing, isn't it? When we talk about we need to be cautious, we need to have a precautionary approach, that only ever seems to apply to COVID and the lockdown, doesn't it? As opposed to understanding that we're on a seesaw, and so being a bit more optimistic, perhaps, or I would say realistic about the prospects of coming out of lockdown sooner rather than later, that you have a clear, absolute, quantifiable upside which is being ignored, which is children going back to school, people going back to their jobs, people being able to see their families. There is a clear, absolute, factual, provable upside to that, as against a possible, very pessimistic computer model of what may happen. And we often seem to be weighing things up rather unequally. We don't seem to pay so much attention to the data on the other side of the seesaw.
That's absolutely right. And I think this is also compounded by having these rather extreme scenarios. So talk about if we just, on March the 8th, let everything go and had no restrictions at all and go wild. That's never going to happen. So it's
I would throw a great party on that day if I was allowed to, though, I have to say.
But nobody sensible thinks that should happen. No, exactly. Although you might have a good party by yourself, probably. It would be. So we do need to say, well, listen, we're going to live with some restrictions of some kind for probably the remainder of this year.
Oh, God.
So let's look at getting the balance right between us, enjoying a reasonable social life, doing most of the things we want to do, meeting the people we want to do, getting our kids educated, getting the economy back, and just trying to get that balance right. And I think the way to do that is to start thinking more holistically, globally, saying, well, we can't just focus purely on deaths. That's the wrong parameter now. We've got to be looking much more across the board
Yeah.
to say, how do we take all these things into consideration? It's doing these cost benefit analyses, and I've been working with teams that are doing this, looking at what's called quality of life years. So if there is a cost of keeping kids away from school for a year, which has a huge impact, which you can actually measure in terms of deaths.
And that's and we know that is a real thing that is actually happening, as opposed to something that might happen.